We're going to get started. I wanted to share with you a couple things. Number one, we're wearing headsets because we found that the audio is a little bit better. We're easier to hear with the headsets on. Um, so that's to explain that. Everyone's muted. There's close to 75 households had joined the webinar or had registered for the webinar. So we're expecting to have, somewhere near 60 or 70 people. So it'd be really hard to have everyone's audio up. But there's a question and answer box that you can use. And we're going to try, as myself and my son Jordan present, uh, we're going to try to answer all the questions that we can and, share anything that's, hopefully, questions that are pertinent. We'll try to share some of those with the group. And if there's something that you have a question of a personal nature, you can also email that to admin at dmia.us. And we'll be able to get an answer to you by Friday. Jordan and I are going to be in a seminar all day tomorrow. So we probably won't be able to answer all the questions until Friday, but we'll have all your questions that we don't answer during the meeting answered by Friday. So I just wanted to take this opportunity to introduce my son, Jordan, and I want to let you know that I'm not going anywhere. I'm going to be around for a long time, but I've gotten to the point in my business that it's really important for me to have more help and to find somebody that I trust to bring into my business to help my clients. I really had to find somebody that I know shares my values and my work ethic and my concern for my clients. So I was really proud when he said that he would join me. We're facing some unprecedented changes in the Medicare market this year. And this is the reason I brought Jordan on board. I needed to be prepared. Last year, it was a pretty stable year for Medicare. There was changes, of course, there's changes every year. But I only was able to meet with about half of my clients, or only about half of my clients wanted to do a review. But this year, it's more important than ever to do a review. So that's why I needed to bring my son Jordan on board. And he's been training with me for several months in the licensing process, contracting, learning all about Medicare, and learning all about, our process of how we help people. Um, I want to continue to grow our business, serve our clients, and accept referrals from our clients, financial advisors, accountants, and other people that we work with, professional people that from community managers and people in healthcare that have been kind enough to extend a good word about our service. So I wanted to be able to grow and keep up with that demand and make sure that people get the service that they deserve. So I want to let you know a little bit about Jordan and what he's about. Jordan's very reliable, diligent, hardworking, and professional. He's a family man, and I have 4 grandchildren, beautiful grandchildren that Jordan and his wife Amy raise out in Granville, Michigan. And I can't say enough about his character. He's a referee. He calls all the balls and strikes just right down the middle, fair. Um, he's he's a leader in his community, in his faith community. He's the kind of person you can rely on to give you good answers and to research those answers and help you get the information you need to make an informed decision. So, and to give you a little story about the kind of person Jordan was, even when he was a kid, if he was given a task, he would do it to the utmost of his capability and then some. putting in more effort than anybody I know at any task that he encounters. When he cut the grass, he edged it to perfection, weed whacked it, cut it both ways, and he was always proud of a job well done. Well, I've seen that in his entire adult life. Any challenge he takes on, he takes it seriously. And I'm proud to have Jordan join me in this endeavor. So I feel really good about having him with me. Um, I want to get into, have Jordan present some of the changes that we're looking at, some of the challenges we're looking at coming up in 2025. And before we do that, I just wanted to, hear a little bit from Jordan about his why you joined the family business and what you're hoping to accomplish uh, together.
Yeah. Thanks, Dad. Thanks for that introduction and those kind words. I really appreciate it and am honored to hear those things. Uh, the funny thing about that story that you tell about, cutting the grass and, the detail and the hard work that it was is that I didn't actually like doing it like that at that time, right? But that's how I was taught. So that's how I did it. Um, but that is also how I cut my grass now, right? So the way that you taught me to do things is something that is, instilled in me. And, I really have been so grateful of all that we've, gone over together you know, for the past few months, we've been going through this process, but, we've been talking about your business continuously together as you've, developed it and you went out on your own to start your own business like this. And, it was something I was really proud of when you were doing it. And you know, the way that your clients talk about you and the way that other professionals talk about you as a leader in this industry has made it, something that I'm really proud to be a part of. And not just so that it's just a family business, but so that your hard work becomes a legacy. Because I don't want to see that stop. I want to be a part of that. And I want to, get to know your clients and get them to trust me and help them the way that you've done it. So I'm just really grateful to be here and am excited to meet all of you.
Okay.
Some of you I've known for a little bit. Scrolling through the list, some of the people here I've known most, if not all of my life. So
Well, yeah. So, do you want to get started with that presentation to show, kind of that overview of changes with the Medicare of what to expect and
ye-
kind of that kind of stuff?
absolutely, let's dive right in.
Okay.
Okay. I'm sharing a screen now that says Navigating Medicare in 2025, your essential guide to upcoming changes.
Looking good.
Okay. So a couple things that we're going to talk about tonight is we're going to do a quick review of Medicare and how you can get your Medicare either through a Medicare supplement or Advantage plan. Um, and then we're going to talk about changes for Medicare to look for in 2025. And then we'll end with the next steps on where to go from here. So Medicare consists of two parts A and parts B that make up original Medicare. Um, Original Medicare will pay for 80% of your medical expenses, and then you are responsible for the other 20%. There's no prescription drug coverage with original Medicare, but there's also no network of doctor, or we'll get into that with so a Medigap or a Medicare supplement is how some people choose to deal with that 20% that they're responsible for. A Medigap plan has a monthly premium that you pay, but in return, and that 20% is paid for in full to your provider. There's no prior authorization that's needed with a Medigap plan. There's no networks, but So the only thing that you really need is a Part D plan to go along with it to help pay for your prescription drugs. The other way that you can receive your Medicare is through a Medicare Advantage plan or a Part C plan. How that works is that a private insurance company takes over your original Medicare. Medicare will pay that insurance company somewhere around $1,000 a month for you, but then you are responsible for deductibles, co-pays, and co-insurance. Sometimes you can also have a monthly premium to go along with it. Medicare Advantage plans also require prior authorization for some services, and a recent study found that around 13% of prior authorization claims are denied. Other advantages with a Medicare Advantage plan are over-the-counter benefits, gym memberships, dental coverage, and things like that. But every Medicare Advantage plan is different, so the details of your plan might not be the same as what your friend or neighbor has. Medicare has different enrollment periods. The enrollment period that we brought you all here to talk to you about tonight is the annual enrollment period. That starts on October 15th and it runs through December 7th. And we can start meeting with people on October 1st. So any plans or changes that you make to your Medicare during this time are effective on January 1st of 2025. In the new year, there is another open enrollment period where you can make a change to your Medicare Advantage plan, but that's only to change. You can't add Medicare Advantage at that time. There's also initial enrollment periods when people first become eligible for Medicare. And just because we have you all here, we want to also remind you that there are special election periods. These aren't very common, but some of the most common ones are if you move out of a covered area, if you are diagnosed with a chronic disease, or if you become eligible for extra help. So the changes to Medicare in 2025, we anticipate that there will be a lot of changes and that everyone will pretty much be affected by it, whether you have a Medigap plan or Medicare Advantage, we're going to be seeing some changes. So it's more important now than ever that we talk with you during AEP. So what is causing all of this change? The Inflation Reduction Act, which was signed into law in 2022, there's been phases over the last several years. So in 2023, we saw that if there was a recommended vaccine, everyone was able to go and get that vaccine for free. And if you are diabetic and needed insulin, that monthly cost was capped at $35. In 2024, there was a small shift in how certain coverage took place during the catastrophic phase of prescription drug plans. But in 2025, we're going to be seeing the biggest changes. So there's going to be setting a $2,000 annual out-of-pocket maximum. The $2,000 out-of-pocket limit includes amounts paid during the deductible phase and the initial coverage phase. Other changes are an elimination of the coverage gap or the donut hole. The coverage gap phase was especially difficult for individuals with high prescription drug costs, as there was a drop in the amount of coverage that individuals reached a catastrophic level of coverage, or until individuals reached it. There's going to be a new Medicare prescription payment plan program that's being implemented. And the way that this plan will work is it allows enrollees to pay for prescription drugs in monthly installments instead of paying large lump sums for their expensive medications. This will be especially helpful for those who will reach the $2,000 catastrophic limit because it allows the cost to be spread out over the entire year. This is something that you have to opt into. Participating in the Medicare prescription payment plan will require coordination with your insurance plan and your pharmacy. So we're going to talk about it more in a moment, and I'll provide an example of how it might work, but it is something that is going to be administered by your insurance plan. And we just really want people to have this on their radar so they're familiar with it. They know that, in the new year, if they want to be a part of this, they need to contact their insurance plan and coordinate this with, so that they can coordinate, the insurance plan can coordinate it with your pharmacy. Um, Other things that were changed is an establishment of a discount program that requires participating manufacturers to provide discounts on applicable drugs in the initial coverage and catastrophic phases, and changes in the shared cost sharing among enrollees, plans, manufacturers, and CMS. So this graph or chart here kind of shows the difference in how prescription drug coverage worked in 2024 versus how it's going to work in 2025. So just so we're all familiar with how these terms here, the deductible phase is what you pay before your plan will pay anything. It could be a good time during, that first time that you go to the pharmacy in 2025 and your plan's not working yet, that could not paying yet for your prescription drugs. That could be a good time to opt into this Medicare payment plan, because that will give you the full year to spread those payments out over, especially if you plan on reaching that $2,000 catastrophic level. The initial coverage phase is when your plan starts to kick in and cover the cost of your prescription drugs. During the initial coverage phase, you either pay a copay or co-insurance to go to get your drugs. There is this coverage gap phase here in green, which is called the donut hole. The coverage gap, and it's going away, is a period when your insurance would not pay for your prescriptions until you had paid enough into it that you had reached a catastrophic level. So the catastrophic phase, which for 2025 will be $2,000, is when you no longer have to pay for your prescription drugs. A couple other things to know about this is not all plans have deductibles. This chart here does not include low income subsidies. Cost is shifting from consumer for the coverage gap to the insurance carrier. So, and also in some parts to drug manufacturers. The idea behind it is that it's lifting some of those costs off of you and allowing you to spread it out over the course of the year. So the Medicare prescription payment plan program, I'm going to provide a little bit more detail about it here. So in 2025, all Medicare prescription drug plans, so both standalone Part D, PDP plans, and Medicare Advantage plans that have prescription drug coverage, they're called MAPD plans, are required to offer Part D enrollees the option to pay out-of-pocket prescription drug cost in the form of capped monthly payments instead of all at once to the pharmacy under the Medicare prescription payment plan. A client can opt in at any time to set up monthly payments. You must opt in each year that you want to participate in it. So if you have low drug costs and you're not going to, based on that, reach the $2,000 level, it might not be something that you want to participate in. But an example that they give is Joe picks up drugs at the pharmacy in January. The pharmacy says it will cost $850. Joe can say no and still get his prescription. The pharmacy notifies the carrier. The carrier will take the $2,000, divide it by 12 months, and he will be billed roughly $167 a month. We are not anticipating that you'll be able to go and do that on January 1st, especially if you don't try to coordinate this with your plan beforehand. So we're really suggesting that in January, you contact your prescription drug insurance if this is something that you want to participate in and ask how to best coordinate this with your pharmacy.
And Jordan, there's no interest in that.
That is correct. There is no interest. Um, so, and because you want to make sure that the pharmacies are receiving that information from your plan, we would also recommend that you contact your pharmacy and say that this is something that you've talked with your insurance about and that you want to participate in, just so everyone is on the same page when you're going in to pick up your drugs for the first time in the new year, so that you're not stuck waiting there longer than you already probably need to be. Nope, went too far. So, what can all these changes mean? One thing that we're anticipating is higher premiums for standalone prescription drug plans, fewer prescription drug plans available, so that some plans will be eliminated. And also, there are some plans that are going to be non-commissionable for agents, meaning that they're going to stop paying commissions. And my dad will go into that a little bit later. But other changes will be stricter formularies. And this is a great reason why we want to set up time to talk with you. Stricter formularies can mean that some drugs will either be dropped from a plan's formulary or the drugs can be moved from one tier to another tier. So we want to review that with you beforehand so that you're not caught off guard in the new year that your drugs aren't covered the exact same way that they were covered in 2024. Another thing that we could expect is more drug utilization reviews. Those are things like step therapy and quantity limits. Um, because this is such a wide sweeping thing, it affects MA plans and MAPD plans. We could see reduced benefits on Medicare Advantage plans, including higher copays and less supplemental benefits such as dental and over-the-counter, those OTC cards that you can get. So it's just all of this is why this year we really want to do a Medicare review with you, and you really should. For those with a Medigap plan or Medicare supplement, we're not anticipating change in the plans themselves because they are still going to be responsible for that 20%. Um, and those plans are standardized, so they all cover the same thing. But what's different about them is how they calculate their premiums. And we're anticipating that premiums are going to go up. So that coupled with changes in prescription drug premiums, we really want to go over that with you so that you're prepared going into 2025 as to what that can look like. So now what? First is that we're here for you and we can schedule an appointment starting on October 1 and you can give us a call 810-209-4800 or go to our website dougmcculloughinsurance.com. You can book an appointment online right there through it. But so that concludes the things that I have to present about and talk to you about right now. I'm going to turn you back over to Doug so that he can continue.
Okay. Well, thank you, Jordan. You did a really good job with that. I appreciate it. I wanted to get into a little bit more detail about, how things are going to work in the coming year and what to expect. Jordan had mentioned that one of the top prescription carriers is eliminating commission payments to agents and stripping the agents of their ability to serve the clients. So we're anticipating that this company is intending to try to switch as many people to Medicare Advantage from prescription drug coverage as possible. That's what we've heard about the strategy. And again, we want to make sure that no matter we're going to give all of our clients a review, even if they are they have insurance through this carrier. We're going to make sure that they get a thorough review. If that plan's still best for them, we're going to encourage them to stay with that plan. If there's something comparable or better, we're going to show you what those options are, so that you have an opportunity to support our service. We're, I brought Jordan along so that we can grow our business. We have a goal. We're going to add 100 new clients to our practice this year, and we can only do that with the help of referrals from clients. That's how probably everyone on this call has heard about us, is by referral. So we're going to work hard to earn your business and to make sure that your plan is reviewed and your needs are taken care of. And if you can pass the good word along to others, we're going to make it easy for you to do that. We've done a few things to help us collaborate and do a good job on your reviews. So we've improved our client information gathering and our scope of appointment process this year. We've also upgraded our customer relationship management, where we keep all our client data, and we run our video meetings out of it and our phone calls out of it, so that we can maintain our records of how we're helping our clients. So Jordan will be helping with reviews this year. We're going to be having 3 half-hour huddles throughout the day, so that we can review people's cases. Again, having your information ahead of time allows us to get ahead of things and look at options and look at opportunities for you to improve your coverage in the coming year. One of the tools, I want to get you familiar with our website, because that's a real good place to start. If you want to refer someone to us, starting at our website's a really good place to get to know us for a client. It's probably less intimidating than calling us. It's a great way for people to learn more about our service. So I'm going to show you, DougMcCulloughInsurance.com is our website. I just got an abbreviated version, DMIA.us, that takes us to the same webpage as DougMcCulloughInsurance.com, because that's kind of a lot. A lot of people can't spell, don't wind up spelling McCullough exactly right, and then you don't get there. So this is our website that we use to gather information. We have our Medicare questionnaire there. When you scroll down to the center, we have a place to schedule your meetings. We have a ACA individual health care questionnaire. If you aren't on Medicare yet, sometimes people have in the household, some people are on marketplace coverage. This is a place where you can update your information. And there's also a place, where you can see and leave reviews based on our service. So I want to start by showing you how easy it is to schedule an appointment by using the website. You can always call our 810 209-4800 to schedule an appointment. But you can schedule a meeting just by clicking here, and you can say, okay, booking policy. You want to schedule your annual Medicare review. You choose an agent, continue.
Dad, are you showing your screen?
Oh, hang on. Let me go back. Okay. I'm gonna start from the beginning. I'm going to start right from the beginning. So here's how you schedule a meeting from DougMcCulloughInsurance.com. Again, you can also put in DMIA.us. you just click schedule a meeting, click OK to our booking policy. And if you want an annual Medicare review, you click on that and you can book for me or Jordan. So I'm going to book an appointment for Jordan. Continue. We're going to look at October 1st. And we got a 9:30 appointment. I'm going to put my information in, my phone number, and my email address. Simple as that. The appointment's booked, and it's going to send you not only an email confirmation, it'll send you reminders by text and email as well. Okay? Okay. Can you still see my screen?
Yep.
Okay. So the Medicare questionnaire, we've updated our Medicare questionnaire, so it also includes the government required scope of appointment form that I have to have 48 hours before our appointment. So we'll be scanning to make sure that we've got these forms completed. And if not, Jordan will be reaching out, or myself will be reaching out to make sure that we get the scope of appointment form and this information, to get your review started. So if you click enter on the Medicare questionnaire and get started with Doug and Jordan, this is permission to for us to contact you. So if you send somebody to this website, to our website, to ask for a Medicare review, this is what will allow me to make an outbound call to your friend or family member or client that you refer to me. So then I put in my name. And we get started. So you put in your email address. Street address. I'm not going to work on the questionnaire for the marketplace, but it's very similar to this. So this is where we ask information about your drugs and your pharmacy. So you can put in your pharmacy. If you just start typing what pharmacy you like, I like Kroger, and you hit search. You can just pick your pharmacy that you use. You can pick up to 3. So I can put in CVS. Click search. And that one's closed. Here we go. Okay, so those pharmacies, if those are pharmacies you like, that's fine. That'll help us kind of narrow down some plans for you that are preferred in network providers with your pharmacy. So then your prescriptions, we'll ask you to add a prescription, and you're going to start typing. I recommend when you get ready to do this step, have your prescriptions, any bottles with you or your list with you. You just start putting in the name of the medicines. I'm gonna put the brand name, singular, add. Wait, I think I take the generic. So I'm going to click that, and it's going to give me the generic for singular. And then my dosage, and I like to get a 90-day supply at 90 every 3 months. And then I add prescriptions. So I also, let's see, trying to get off of this one, but there we go. So, and so on. So,
You said
if I,
every 2 months.
oh, every 3 months. Okay. And then if everything looks good, you just click OK. I'm just gonna try to submit this without putting my dosage in and see what happens. Hang on. Okay. Confirm prescriptions. If you don't have them in there, it might prompt you to add the dosages or the quantities. But I guess I had it in there right, so it accepted it. So tell us about your doctors and hospitals. McLaren, Port Huron is the closest one to us. So I'm going to put them in for the hospital. And then my primary doctor. And I got a specialist. Put in your first name and last name is best, especially if I'm shopping for if we're shopping for a Medicare Advantage plan for you, because it's really important for us to check out providers. Okay, so I got that. So this is the last step. This is for the CMS Center for Medicare and Medicaid Services requires agents to document scope of appointment before a marketing appointment. So I need to have this in about 48 hours prior to when our meeting is scheduled. So it'd be great, when you schedule the appointment, if you can go and click over and do this questionnaire at the same time, that would be perfect. So this starts the process for us to do the scope of appointment. You're going to initial where it says standalone prescription drug plan, Medicare Advantage plan. You're initialing for Medicare supplement and ancillary products. That way I can talk about, or Jordan can talk about pretty much everything. Okay. And then you click your signature option. I like this one here. That looks just almost like my regular signature, almost, except for the penmanship. Okay, we're all set. So, so then this comes to us, and then we're going to have this in advance of our meeting so that we can prepare and, review, investigate options so that we'll have options that are well suited for your situation when we do our review meeting. So that's one more thing I have for you today that I wanted to share. Hang on just one moment here. This is a link here, and I really want to take a moment to thank my clients who have taken the time to leave me a review on Google. This is a link to our Google reviews, and if I want you to know how important the Google reviews are to us, we received about 30 new clients last year alone because people were impressed with how good our Google reviews were. So as you can see, right now we have, I'm going to make this a little bit bigger. We have 83 5-star reviews. And when you look at them, most of these reviews, okay, that's how you can leave a review. but most of the reviews that we have,
I don't think you can go into it because you're the administrator.
okay, here we
Oh,
go.
you can.
Here's some reviews of what people say about us and why it's so impactful. People read through a handful of these reviews and they say, wow, this guy might be worth a call. And it makes a big difference in our business. Instead of paying for advertising, it's kind of a different way for you to give us word of mouth. Um, the Granville office, because Jordan's new, he doesn't have quite as many reviews. So if you interact with Jordan and you feel like you'd like to give him a review, it would be really appreciated so that he can make inroads into his local market. And that's another way you can help us grow our business and, make sure that we're around for many, many years to come, which I think is one of our main goals of why we brought Jordan into the agency, because we want to have continuity for our clients. That's very important to us to make sure that you have somebody that you can trust to help you with your Medicare. So Jordan, that's all I have for today. Do you have any, is there any questions that we have that popped up that
Yeah,
that we want to answer?
yeah,
Okay.
there are. So someone had, based on what I was saying about the prescription drug plans and the formularies and the tiers, that is concerning as for people that drugs that maybe used to have no cost are going to change in the future. That's why we want to do these reviews with you. And we can start talking about plan details on October 1st and get into those details with you then during your annual review.
We don't even have the plan details as of right now. And even if we did, it wouldn't be in compliance with Medicare regulations for us to discuss it before October 1st. So
Yep.
that's why we're looking at October 1st. You may receive some information about your plan in the mail as far as an annual notice of change from your provider, and it may have some details there. But I think it's best for us to schedule for on October 1st or after, so that we can not only go over your plan and how it's changing, but we can personalize it to you by having your medications, and we bounce those medications against all the plans that are out there so that we can, figure out which plan is going to be the most economical for you in the coming year, whether it's a prescription drug plan, whether it's Medicare Advantage, or if you want to look at your Medicare supplement. We're here to help you with all of that.
So a couple more quick questions. We have a few minutes. And I think this is about when we were typing your prescriptions into the form and should it not autofill automatically? So in case it wasn't clear, as you start typing in those first few letters of the medicine that you're taking, it will start to populate suggested answers. And you just need to put in enough letters for it to get to where you see your drug. And then you can click on it and put in the dosage and the frequency information.
Thank you.
Uh, Dad, can you tell us how can I get a 2025 Medicare book?
So the 2025 Medicare book, I don't know if that's out yet. Okay. Um, but you can go, let me Google that right now.
See if I can Google it faster.
Probably can. Yeah, I don't think the 2024 is out,
Yeah.
but 2025 isn't out yet. I don't know when it's expected to come out, but so even when it comes out, sometimes, we don't have all of the changes for the coming year as far as what the deductible is going to be, what your premium's going to be. Some of that information doesn't come out until October. So it's part of the budgeting process that the federal government is establishing what the monthly payment you're going to be paying for Part B, the Part B deductible. That's all uh, sometimes comes in after the most recent one is in print. So they usually try to hold off, I think, until the first quarter before they release the 2025 Medicare and U book. 2020, you can just Google 2024 Medicare and U, or if you just send us an email, we'll send you an electronic copy of it. So you have it for your reference. And I think the electronic copy is probably the best because it's easy, it's very searchable. It's in a PDF, so you can search it, what you're looking for. I don't think the Medicare and U books are very well organized. So I think having the electronic version is a very good idea.
There was one more question that we really won't know the answer to, and we're about out of time, but I'll read it really quick. But are we anticipating it to be more difficult for prior authorizations? And we
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 don't,
definitely wouldn't know that, but
yeah, I think that information about prior authorization is probably closely guarded and proprietary. It's not published in a way that you can compare plans, unfortunately. I wish that it was. I mean, we have a sense that, we're more biased for Medicare Advantage towards Michigan plans, as far as being easier for uh, providers to work with because they're used to working with them. But I really don't know what the statistics are. It, like, again, it's a closely guarded secret among the Medicare Advantage plans. And if I find out, if I find that information, you're going to be the first to know it. Anyone that's on Medicare Advantage, because I want to share more information with my clients rather than less. And the statistics that Jordan was sharing are about 2 years old, and they they pick 6 random Medicare Advantage plans to do that study. The study was done by the Office of Inspector General that oversees Medicare and Medicare Advantage. Okay.
okay. I don't have any. Hold on one second. Let me send this off and see what else we need to read here. Okay. So more that'll be all the questions that we can kind of go into at that, for this type of setting, but we have more questions that we can try to get responses to individually after this.
Thank you. Well, thank you for joining us tonight. That's the conclusion of our tonight's presentation. We look forward to doing your review this year, and you guys have a great rest of the. I can't call it. I'm going to call it summer because it's still nice out there. But have a nice few weeks before we meet in October. Thank you so much. You have a great day.
Take care, everyone. Bye.
Bye bye.